Hey everybody, today I'm going to be talking about budgeting for your health care. My previous videos were about budgeting in near or in retirement, mostly getting to retirement and figuring out what you're doing, how you're going to retire on a minimal budget. And this one is about budgeting for your health care. Most health care plans don't include a lot of things which you have to pay out of pocket, which is maybe copays for doctor's visits, prescriptions, physical therapy if you need it, specialists, hospitalization copays, and deductibles. My current plan has a $4,000 maximum, what they call out of pocket, which means once I have paid $4,000 to any and all entities that are within the network, prescriptions, physical therapy, specialists, hospitalizations, deductibles, once I've met the $4,000, I don't pay anything else for the rest of the year. And some people think, well, that's no big deal, I'm very healthy. Well, that's wonderful for you. But if you have issues, any kind of chronic issues or sudden things that come up, this may fit for you. For me, in the past 7 years, 5 years, I've met that $4,000. 4 hospitalizations, numerous 4 surgeries, and numerous hospitalizations. So for me, it's important to budget for it. And $4,000 is really a lot of money when you think about it on a monthly basis. What I have done in the past is just, kind of take it as it comes, pay it as I go, and, then get all these bills from all these different entities. It's a real big pain in the butt. But I've started doing more budgeting things. I set up a budget. I set aside a certain amount every month for medical, I call it, medical health care, whatever you want to call it. And the question that I came up with along these lines is when I was thinking about the amount of money that I spend on supplements. And not necessarily vitamins, but like I take melatonin to help me sleep. I have valerian tea and valerian supplements to also help me get to sleep. I've added CBD oil to that, which is pretty expensive, let me tell you. But it does a lot. It helps me get to sleep. It helps pain. So, do I spend, I think it's went up this year, $30 on a prescription for narcotics, or do I spend $100 on CBD? So, you got to weigh the benefits and the risks and decide what's better for you. I know that for me, at one point, I was on 7 or 8 prescriptions. One of the years that I had, maxed out my out of pocket without even having a surgery due to all the issues that I was having that no doctor could figure out what was wrong with me. I had about 7 or 8 prescriptions. So, now I have 1 prescription that I haven't even filled it in 6 months. So, I'm spending about the same amount of money, but it's more of a holistic direction. So, you can decide which way you want to go with that. But when you're budgeting, you got to think about these things. I'm spending this much on this and this much on that. When I was younger, I thought, okay, when I'm done raising my kid and this is done and that is done, I'm not going to have those expenses anymore. Well, I wasn't sick back then. I didn't have major hospitalizations back then. And now that I'm older, it seems like the trend is going from one area to the other with my money. So, when I retire and I'm on Medicare, then what? Because I won't have the income that I have now. So, I've got to decide what I'm going to do about it then. I don't know what people do that are on Medicare. that don't have a retirement. That's why I'm putting this out there, to maybe help other people think ahead and try to figure out what you're going to do, whether you need to reach out for other people to help, or to change the way you're living. I mean, I know that exercise for me is big. It will help a lot. I'm not very good at it, but when I do it, it does help. Stretching, yoga, those kind of things really help. But a lot of people say they're in so much pain they can't do them. And I understand that because I've been there. And so now I'm rambling. So I'm going to stop here. If you have any questions or you want me to address something, just put it in the comments. I normally read them. I don't have but a couple of people that watch this anyway. So, you know, I try to do one of these about once a week. So if you have any questions, you want me to address something, please leave it in the comments. Thank you.